Have you seen the video of the treatment of Paul Tarashuk?
Yes, I have. I've actually watched it twice now.
And what do you make of how the EMTs handle the situation?
It could have been better, certainly. The patient was not assessed adequately to explain the alteration in mental status, and there was no real plan other than sending it over to the police officer as to what to do with this guy.
I'm watching the way the EMT is interacting with Mr. Tarashuk, and I hear the EMT say things like, "Tell us your damn name, please. I'm not playing. What's your name? I'm serious. I'm sleepy. Give me your damn name so I can go home. For real. I'm tired." Is that appropriate?
No, that's embarrassing for the whole profession. You know, they're taught first to assume that a patient's abnormal behavior or alterations are due to a medical cause. It's only after you've excluded such issues as intoxication or diabetes or head injury can you then discharge them to, for example, a police officer who has much more limited medical care skills.
What kind of tone does that set inside an ambulance when you have people talking in that tone and with that language?
It becomes adversarial and the patient becomes defensive. You know, it is a manifestation of the frustration of the situation, but you're generally supposed to put that aside and treat every patient as if they were ill. They may not have been happy about it, but the patient should have been transported to a medical facility, a hospital.
What were the red flags as you were watching the video that would have caused you to say, hang on, this man may be having some psychiatric difficulty?
Well, he was just basically nonverbal, but in no acute distress. And from our standpoint, that's usually either going to be a substance abuse issue or mental health. You know, there was not enough really effort directed at trying to discern the source of this. They were more concerned with the name and things of that nature.
In terms of how you would instruct EMTs, was this a cut and dried case in your view of being able to walk in and say, we may be having somebody with a schizophrenic break?
No, it wasn't cut and dried because schizophrenia presents in so many different ways. And I think in EMS and even in emergency medicine, we're not really well preparing our paramedics for dealing with psychiatric patients. And this is something that's evolved over time because there's been more deinstitutionalization of mental health patients, and they're falling into the emergency department and the ambulance service.
What is a proper protocol for the use of ammonia?
We've tried to take ammonia out of the EMS system for the last 20 years. There are no protocols for it. They don't even have a role in the funeral homes, which was the original place they came from. Smelling salts.
How important is accountability in this system?
Accountability is the fundamental tenet. You know, you're accountable to the patient, you're accountable to their family, you're accountable to the medical director, you're accountable to your employer. You know, every job has accountability, but in EMS, there are many people that become involved, and without accountability, there can be no good health care.